Let's go live to Adelaide now. The Social Services Minister Anne Ruston joins us. Anne Ruston, thanks so much for your time. This news is just to hand that Ed brought us, the KKR wanting to launch a takeover bid of Ramsay Health, which owns some of our, is the largest private hospital provider in Australia. Would you be a little bit nervous about that kind of deal?
Well, look, obviously, all foreign investment in Australia is something that the government takes very seriously to make sure that it is in the best interest of Australia and Australians. But what I think it shows is the strength of the Australian economy, the strength that the international market views Australia with. Obviously, the results overnight from the IMF around the global outlook, seeing Australia as one of the few countries that have had their outlook improved, whereas many other countries have gone backwards. I think it speaks very much to the strength of the Australian economy, but of course Australia must always determine any changes or any investment in this country to make sure that it's in the best interest of the country.
An important step to returning to normal is getting rid of those close contact isolation rules. New South Wales and Victoria are about to scrap those. Is that a good idea or too soon?
Well, obviously the best health advice must underpin any decisions that are made by any governments in relation to health. And obviously I think every Australian is really looking forward to getting back to as close to normal as possible, close to pre-pandemic conditions as possible. So I think, if the health advice is there, that it's safe to do so, then I think most Australians would be rejoicing about the return to normality.
We're not just solely relying on health advice anymore, are we? I mean, at this stage in the pandemic, you've got to look at the economics.
Well, look, absolutely, and I think they go hand in hand. But, first and foremost, I think Australians can have had confidence that the decisions that have been made throughout the pandemic have largely been based on health advice, because first and foremost, people's health and safety is an absolute primary consideration of any government. But of course, the economy is very important, and I think the track record of the government through the pandemic, where we've saved so many Australians' lives on the basis of our health response to the pandemic, but at the same time coming out of the pandemic with, still have a AAA credit rating and having the strong economy that we have, I think speaks volumes for the way Australia and Australians have handled the last 2 years.
Labor seems to be gaining some traction on making a bit of a scare campaign about Medicare. Why do you think there is this fertile ground? Is it because of the support of the co-payments in the past, the wanting to privatise the backroom? Well,
look, I would suggest that the reason that we're seeing scare campaigns, and it's not just this scare campaign, we've got many of them running at the moment, is because they just don't have solid policies. And when they put policies out into the marketplace, they get torn down by the experts. And so I think they're resorting to scare campaign tactics, which is really pretty sad, because scare campaigns do not make up for good policy. And I believe that the Coalition has got great policy. Our track record in healthcare and in Medicare speaks for itself. In 2012-13, when Labor was last in government, $19 billion spent on Medicare. 10 years later, the Coalition will be spending $31.4 billion on Medicare. And at the same time, we've increased bulk billing rates from 82.2% to 88.8%. Nearly 9 out of 10 times somebody goes to a doctor in Australia, they're getting that appointment for free. I mean, that's what speaks to it's speaking to policies, strong policies, and it's a strong economy that allows us to continue to provide these strong investments in things like healthcare.
Anne Ruston, can you rule out any cuts to Medicare?
I can absolutely rule out any cuts.
Why was it so hard to do the other day?
Well, I thought I was quite clear when I said that our track record speaks for itself, as I've just outlined. When I said that we were the government that guaranteed Medicare in legislation, I said quite clearly on Sunday that cuts were ruled out. The Prime Minister then said it again on Monday. I thought I was very clear, but can I be absolutely clear today? There will be no cuts.
Okay, do you accept that going to the doctor has got more expensive under your government?
Well, obviously, there are a number of things that our government has put in place to make sure that healthcare is more affordable for Australians, but also making sure that they've got access to new and interesting and inventive ways to actually access healthcare. I mean, just as an example, over the last 2 years, we've seen telehealth 100 million telehealth appointments for 17 million Australians. We've now made that universal and permanent feature of our health system. So we will continue to work as a government to make sure that we have an affordable health system. I mean, the 2,900 additional medicines or amended medicines that are now on our PBS also speaks to the affordability of our healthcare system. But I think that our track record shows that we are absolutely committed to making sure that we've got a world-class health system, which I believe we have, and we will continue to improve it in the best interests of Australians.
Your track record isn't great on aged care though. It's been in a slow demise for the better part of a decade, and still this government has not fixed it after a Royal Commission. Will aged care be under your remit as well?
Well, the Prime Minister announced on Sunday that should we be fortunate enough and the Australian public give us the honour of being returned as a government, that I'll be the Minister for Health and Aged Care. But what I would say, Laura, is that we were the ones that called the Royal Commission. We are the ones who've responded to the Royal Commission's findings. We are the ones that have put $18.8 billion on the table to support the recommendations and implement the recommendations of the Royal Commission. Look, we accept that there were a lot of things that were wrong with aged care, but that's what we are addressing at the moment.
You say were, though, that they still exist. There's massive staff shortages. You've been criticised by one of your own in Mike Baird, who's supported Labor's push to have a nurse on staff 24 hours. I mean, is that too much to ask?
We have accepted the recommendation of the Royal Commission for nursing staff to be on premise 24 hours a day, 7 days a week. But we also accepted the Royal Commission's recommendation that it would take us until 2024 to be able to do this in a way that didn't have detrimental and consequential impacts on other areas of the health care sector that rely on our nursing staff. So we are absolutely committed to doing that. In fact, already we've put $3.9 billion against introducing 16-hour nursing staff on site as a transition towards 24-hour, 7-day-a-week care. I mean, the Labor Party came out and made this announcement on the budget reply night, and then had to pedal it back. I mean, Mr Dreyfus said that they would have to pause it. Mr Albanese admitted he didn't know where he was going to find the nurses from. Yeah. It's all well and good to make these promises, but they must be deliverable. We have been absolutely focused on policy that is deliverable to make sure that we don't make promises that are not able to be delivered.
David Littleproud has said that your government could extend the Murray-Darling Basin Plan deadlines for returning water to the environment. Labor has accused the Nats of blowing up the plan, given this is such a big issue, a hot-button issue in South Australia. Do you agree with David Littleproud?
One of the things that I think is really important to let your listeners know, Laura, is the fact that this government is absolutely committed to the delivery of the Murray-Darling Basin Plan in full. We have been working tirelessly over the term of the plan with the other states and territories to make sure that we achieve this in a way that was delivering the environmental outcomes that we all want to see, that we don't destroy our river communities, their economic and social fabric of those communities that put the food on the table of every Australian every night of the week. So, I mean, I think we all need to be focusing on making sure that we get the plan delivered. We get to deliver it in a way that delivers that triple bottom line, that we support our environment, we support our economy, and we make sure we don't destroy our regional communities.
So does that mean you could extend the deadline?
The most important thing is that we deliver the plan in full. I mean, we know that there have been some challenges in terms of the delivery of certain aspects of the water targets. This is a very comprehensive plan. It's a very detailed plan, but we are absolutely committed to it. And I'd call on every single Australian who has any say in how this plan is delivered. Stick the course, stay with us. We can deliver this plan in full, and with everybody's continued commitment, we will deliver this plan in full.
So is this a bit of an internal fight between the Libs and the Nats, SA Queensland thing? A bit of wrangling going on behind the scenes?
Well, obviously, I mean, everybody wants to represent their constituency and I mean, I obviously very strongly support our rural and regional communities to make sure that our water recovery methods are done in such a way as we don't destroy the fabric of their communities and also that we don't destroy our income-earning industry, agriculture on the way through. But that's not to say that we can't do it, but we need to do it in ways that doesn't just rip water out of our communities. We need to do it using innovation and technology, being smarter about how we deliver water, making sure that, urban and industrial water is actually playing a role in returning water for environmental purposes. They're clever ways that we can do this, and I think we all need to focus on those clever ways so that we do it.
Anne Ruston, thank you.
My pleasure. Thanks, Laura.